Hey everybody, I am going to talk to you today about the perils of mouth taping. Now, mouth taping shouldn't never even be a thing before someone has seen an ear, nose and throat doctor. Mouth taping is all about literally putting some tape over someone's mouth, and I've seen various things where it's basically the whole gaffer tape thing versus a little strip of tape to force the lips closed. And the premise is that if someone is mouth breathing, that will address their mouth breathing by forcing them to breathe through their nose, and they'll relearn how to breathe. Now, you're not relearning how to breathe if you're being forced to breathe through your nose. And there's a couple of things I want to talk about that can go wrong with this. The first one I'm going to do is actually use myself as an example. So for years, I had a deviated septum that I never knew about. And it wasn't until someone had a look in my nose that they found one. And this is a very common thing for me to experience in terms of me being the doctor rather than the patient, because when you've had a problem with your nose for a very long time, that is just your normal. You get used to it. You don't realize that you have a problem. Someone draws your attention to it and you go, oh, okay. Then it gets fixed. And then a couple of months after it's been fixed, like, wow. Like a lot of patients say, and myself included, I wish I'd done this a long time ago. Now, my septum was deviated to my left. I'm off to a good start there. Deviated to my left. This is my left. So, breathing through the left side of my nose was never as good as it could have been. Now, I managed to overcome that because I increased my respiratory effort. And by increasing my respiratory effort, I could overcome the resistance. But when you do that, that generates more of a pressure effect. It's like if you're drawing up a syringe and you're pulling back harder, it'll suck it up more, but you've had to create that extra pressure to do it. It's the same as breathing through the nose when it's blocked. It increases the pressure. Now, one of the things that pressure does is obviously draw air in, but it also can start to weaken the cartilage on the outside of the nose, okay? And that's actually happened with me. Now, I'm just going to show you my now normal nasal breathing. And I want you to look on the side wall of my nose. So I'm trying to do this. It's not easy. Okay? No problems at all, all right? Now, I just want to show you what happens if I block this nose, all right? So I go back to, in essence, having a nasal obstruction. I'm going to keep breathing through my nose. I want you to look just here. Can you see how that collapses in? And you can hear me, sort of, the breathing gets laboured because as I'm breathing in, it's actually getting dragged in and collapsing. So that has come about because I had a blocked nose and through increased respiratory effort could overcome that obstruction, but in the process I was actually putting pressure on the nasal cartilage, and that nasal cartilage has lost some of its strength. Now, with my breathing being normal now and unobstructed, when I breathe in through my nose, the pressure that's transmitted allows the air just to go straight through, so it doesn't cause a suction effect on the outside of my nose, okay? So if I give you a different view, I can't believe I'm doing this, all right? So here, okay, versus, all right, so what's the point of all this? Well, let me just put this here for a sec. So the point of this is that if someone has a nasal obstruction, they will mouth breathe. It's not rocket science. And if you then tape someone's mouth and force them to breathe through an obstruction, they may successfully overcome that obstruction by increasing their respiratory effort, but in the process, they're going to increase the suction effect, the stretching effect on the cartilage of the nose, and it's going to collapse in on itself over time. So you actually then end up with more of a nasal obstruction. So that's the first bad problem, okay? The other bad problem is that by increasing the respiratory effort, you go, oh, you're breathing more air in, good job. There is a downside to this, and that is when you breathe in, it doesn't just drag air into your lungs, it drags blood into the chest wall cavity. So it actually increases the ability of blood to flow back into the heart. Now, the reason that's a problem is that in mouth breathers, the blood vessels that go from the right side of the heart to the left side of the heart, so that the blood pumped from the right side to left side goes through the lungs, okay? And in mouth breathers, the blood vessels that go from the right side to the left side, they are constricted. So the heart actually has to pump harder to get that blood through. The problem is when you force a big deep breath in, that also then drags more blood into the chest, which drags more blood into the right side of the heart, which is already overloaded, and then it has to try and pump things through even more. And because it's then got a greater volume to pump through, the blood pressure within that vascular system actually goes up as well, which then puts more of a stress on the right side of the heart because it's had to work harder. So it seems paradoxical, but forcing someone to breathe through their nose can actually be deleterious to their nasal function and also to their cardiovascular system. So mouth taping is an absolute disaster with respect to people that have nasal obstruction, because you are causing a whole lot of other physiological and physical disturbances as a result. So I hope that makes sense. If anyone is mouth breathing, the first thing they need to do is go and see an ENT. There's no other clinician that can make the full proper anatomical assessment to determine what the problem is. And then once it's done and once it's clear, as I've said in other videos, let the dust settle, let the brain readjust, let the physiology reset. Then if after about 3 months there's still some issues, then you can look at the breathing retraining side of things. But to instigate any sort of breathing retraining option whatsoever before the nose is actually clear and it does actually work properly is just a recipe for failure. Cheers.